So, hey everybody, I'm Michael Perretta. I'm the founder of Docket. Very simply, Docket makes it easier for patients to consolidate and share their health information. In its primary use case, it's essentially a appointment onboarding utility. So instead of having to fill out paper-based intake questionnaires when you go to the doctor every time, you can use your Docket app to check into your doctor's appointment. There are two primary touch points of Docket. There's a free mobile app for patients that's available on iOS and Android. It has Apple Health and Google Fit integration and runs on FHIR. And there's also a corresponding web application for providers. Patients first encounter the app through HIPAA-compliant appointment reminder text messages. Typically, a patient will schedule an appointment as they would normally, and our providers will generate in bulk appointment reminder text messages out of our web application. These are scheduled 3 days and 1 day prior to the visits. It's great for a Docket because it's a great way to spread the message about our product and get patients onboarded right away. And it's a great win for our providers who see fewer no-shows and are also able to reinforce pre-visit compliance. So, for example, we have a provider in New York who instructs his patients to stop taking their medication right before their visit. So instead of saying good luck at the FHIR Roundtable, you might get a message that says, hey, remember to fast for 8 hours before your visit. When patients download the app for the first time, they're taken to this tutorial. This really orients them what the app's all about and how to use the app. So the first step is that they'll start inputting some patient-reported information. The app also aggregates data from other sources as well. And when they show up to their visit, they'll scan a QR code that looks like this that'll be posted somewhere in the waiting room or front desk. This is really what makes Docket unique and special. It's very, very cost-effective and scalable to implement, very easy to implement. So providers, all they have to do is sign up on Docket.care. They'll access a unique QR code, print it out, post it in their waiting room. Typically, you might see in the industry where a patient would have a unique barcode or QR code associated with them, and then the care provider, whoever that might be, would have a scanning device. We've inverted that and makes it much easier to implement, but also we get the benefit of higher visibility directly within care settings. Scanning this QR code is the action that authorizes access of that patient's health information to the provider. The main feature of Docket is our boarding pass. So as you might use your Delta app to check into a flight, you'd use your Docket boarding pass to check into a doctor's appointment. So this is really where patients are prompted to input their self-reported information. And we collect that information through a health risk assessment superset that uses skip logic to drill down into underlying health-related concerns that patients typically might not self-report verbally. And we're also able to eliminate duplicative or unnecessary data entry. The app is smart enough to take the prescription inputs and then generate medication reminders that will show up on the home screen of your phone, or if you're wearing an Apple Watch like me, on your Apple Watch. So this is great, obviously, to improve medication adherence, but really what we're after is to encourage daily active use of the app. So we don't want something that someone's going to delete as soon as they show up to the doctor's appointment. This is just one way to keep engaging them. The app is also smart enough to log that adherence, which you'll see here on the screen, and we communicate that those adherence trends to the care provider also as another data point when the patients check in. There's also a document repository feature. So instead of having to take binders of information from doctor to doctor, patients can use this app to consolidate documents, whatever those might be, directly in the app. Those could be photographs of an injury or claims or whatever. And providers on the other end can also securely and efficiently share documents back to the patient. We also have an appointment log feature. This is just a history of your past visits. It shows when and where you've checked into, so who you've shared your data with, and also says why, and that why is captured as the chief complaint for each visit. This is also a screen where providers, and I'll show in a little bit, can send over what we call HIPAA-compliant tweets, so like little short messages back to the patient, say, thank you for visiting, or remember to take your medications as prescribed, whatever that might be. Patients can also use this feature to revoke or reauthorize access of their health information. The last section here would be, we have the settings info. This is just administrative functions that the patient could take. So you can e-sign a HIPAA authorization release form. You can also tether it to an Apple Health or Google Fit account, depending on if you're running the app on Android or iOS. And you can take other set other settings to how you want your health information shared out of Docket as well. When you check into a visit, scan this QR code, you're first prompted by the confirmation message, where do you want to send your data? So this is giving the consumer more confidence that they're sending it to where they want to send it. And once they do click yes, they get a confirmation receipt. If the provider on the opposite end decides to restrict certain data elements from being accepted to the doctor side, we send a receipt message back to the patient, so no one's in the dark as what information was shared. I'm going to try to attempt a live demo really quick. So we'll see if we can check into a doctor's appointment, and I'll show the end-to-end. So as a care provider, to create an account, it's very simple. All you would do is go to docket.care, click provider registration, but I'll just log into one of my test accounts. And we're in. So before I go through the different screens on the provider application, I'm just going to check into my doctor's appointment so you can see that happen in real time. So if I'm a patient, and this is the clinic that I show up to, I'll just fire up my boarding pass on my phone, click scan QR code, and just scan that QR code. And then when I do that, a whole bunch of stuff happens all at once. The system takes a snapshot of my health information at that time, and then uses that to generate HL7 FHIR payload. The system will then perform an OAuth 2.0 handshake, and then send that FHIR message across the API to the doctor. So now that I've clicked yes, you should see it appear. There it is. So there's my Alexander Hamilton test patient. As the provider, you can take a number of different functions from here. And by the way, I say provider, but this could be a front desk staff or some other some other professional in the clinic. But one of the functions I can take is just to view this information. And we've organized it differently in the web app than in the mobile. That might be more provider friendly. So you can see all the different data points listed out here. This would be the demographics, information on care teams, reviewed systems, and so on and so forth. Here would be my medication adherence. So you can see on my test application, I really haven't been taking my fake medications very often. But then you'll see other things like an exclamation mark. This is just a visual cue to the provider that there might be some values in here that might draw immediate attention. So just a quick way to say, oh, okay, well, this might be addressed or might need addressing. We also aggregate Bluetooth-enabled data. So if you have a Fitbit scale that's tethered to your Apple Health device, that Docket is able to ingest those data values and communicate them to the care provider at the time of check-in. So you might see some like highs and lows for weight and all of that trended. But that's everything that would get ingested into Apple Health, and with Apple's medical records APIs expanding, we're going to be able to ingest more and more clinically relevant data. Providers can also export a PDF. So we have a provider in New York that uses Practice Fusion. He'll just save these PDFs directly into his practice management system, or EMR. There's also, I mentioned, a HIPAA-compliant Twitter. So we just made a fun little messenger for, it's a pretty unique way for a provider to say something like, remember to take your, and then we have a little emoji picker for pills, because why not? You can also access a HIPAA authorization release form if the patient uses that e-sign feature. So this is Alexander Hamilton's HIPAA authorization release form. So that might be worth something to somebody somewhere. There's also very easy to access the documents that are embedded within Docket or upload documents from your EMR or practice management system to send to the patient. And then also, we can also get a machine-readable format, which is always fun for troubleshooting or just showing off. Then there's, so I mentioned earlier about text messages. Text messages are very easy to send, to generate out of Docket directly. You can do it individually from just inputting it into Docket, or you can import it from a system like Epic. If you were to do that, we post our import specifications here. You would just generate a standard report out of your EMR according to our import specs and upload it directly here, so you can schedule those text message reminders in bulk. Providers really love this feature. They're very easy to use. It's very cost effective and a great way to onboard more patients and get them in the door. We also allow providers the ability to select which data elements they're not willing to ingest, and that could be for clinical utility or liability reasons, but we don't want to make those determinations. We want the providers to make those decisions. And then to access your QR code, you would just click print QR code and get that PDF to print out and post in your waiting room. And then last, we have the settings panel, where if you are working in a small practice or clinic, you can add your colleagues here so they can have access to the same dashboard. Of course, we have different registration information here and other administrative functions. We also have promo code functionality here, and that's how we're using this right now to throttle our growing user base, so we can expand it and watch how and analyze how our consumers are using the app, so we can refine it better. And just a quick note about what's to come. So I'm just going to read from this brief announcement so I don't mess it up. But this is what to expect with Team Docket in the near future. So since presenting on the topic of consumer-mediated exchange at the 2017 ONC annual meeting, our team has engaged weekly with immunization experts from the U.S. Department of Health and Human Services, Office of the CTO, the CDC and CMS, the American Immunization Registry Association, and Audacious Inquiry. Together, we have developed an innovative model to responsibly yet efficiently integrate Docket with state and local immunization registries in order to expand consumer access to personal and family immunization records. We aim to launch our interagency project this upcoming project year with the Florida Department of Health, an innovation-focused leader in the immunization registry community. This project will not only improve immunization adherence, it will also drastically reduce administrative burdens for care providers and make it much easier for over 2.6 million public school children to re-enroll each year. And as of yesterday, we also have plans to integrate with the New Mexico Department of Health. So if anyone has any questions, I'll be around until lunch. And otherwise, please feel free to drop us a line at info@hellodocket.com. This is not showing up on the screen. Here it is. Or check out our Vimeo. Thank you.